The majority of healthcare professionals say if your lifetime risk of breast cancer exceeds 20%, you're considered to be high risk. Thanks for joining us for this week's Health News You Can Use. I'm Lindsay Stish. We're focusing this month on breast cancer awareness. This week, we're talking about what puts a patient at higher risk for breast cancer, steps you can take if you are, and a unique program St. Luke's has for high-risk patients. I'm here today with Dr. Ruby Meierotto, breast radiologist at St. Luke's Cancer Institute. Thank you so much for joining us today.
Thank you so much for having me.
So Dr. Meierotto, starting off, what factors put a person at higher risk for breast cancer?
The American Cancer Society website lists several risk factors. Some of these factors cannot be changed, such as being female, aging, early menarche, late menopause, certain genetic mutations, and having a personal or family history for breast cancer. Now, there are lifestyle-related factors that increase risk, such as excessive alcohol, being overweight or obese, lack of physical activity, not having children and not breastfeeding, and then certain birth control methods and hormone replacement therapy.
Okay, so what steps should someone take who is at higher risk, and how does St. Luke's unique clinic help with this process?
So a woman should know her risk, and there are several online risk calculators, or you can talk to your healthcare provider about your risk factors. And if you are at high risk, here at St. Luke's, we offer a unique high-risk breast clinic run by our specialized nurse practitioners. In this clinic, the nurse practitioner will talk to women about ways to decrease their risk, such as dietary or lifestyle changes and taking certain supplements. She will perform a thorough clinical breast exam every 6 to 12 months. There are medication and surgical options to decrease risk. And then she may recommend genetic counseling and testing through our St. Luke's program to better understand a woman's risk and her options.
Now, you touched on this a little bit, but do women at high risk need more than just a routine screening mammogram?
So women at average risk should get a screening mammogram once a year, starting at age 40. Women at high risk may need to start yearly mammograms before the age of 40 and may qualify for yearly breast MRIs as well. While these exams do not prevent breast cancer, they can detect cancer at its earliest stages.
Now, what sets St. Luke's program apart?
We offer specialized services throughout the cancer journey, starting with prevention in our high-risk breast clinic, detection by fellowship-trained breast radiologists, treatment through our genomic sequencing and precision oncology services, as well as our multidisciplinary clinics, where patients meet an entire team of specialists in a comprehensive appointment. And then, of course, survivorship through our supportive services in the Kuntz Center, caring for those with advanced metastatic breast cancer. Wherever you are in that cancer journey, we offer compassionate, expert, personalized care.
Fantastic. Well, what else do you want people watching today to know?
I can personally speak to the benefit of the high-risk breast clinic because I started participating this year because my mother was diagnosed with breast cancer last year. Because of the skilled nurse practitioner, Donna O'Reilly, I feel confident that we are doing everything possible to decrease my risk for developing breast cancer. I believe in our expertise, not only for my personal care, but also the care of my mother, who received both screening and treatment right here at St. Luke's.
That's great. Well, thank you so much for joining us today.
I had a great time with you. Thank you.
If you'd like to learn more about St. Luke's High-Risk Breast Clinic, please visit stlukeskc.org/high-risk breast cancer. Next week, we'll be discussing how family and friends can best support their loved ones who have been diagnosed or going through treatment for breast cancer. You can also stay up to date with all the latest developments on the COVID pandemic and other health news from St. Luke's at stlukeskc.org/news. Thanks again for watching. We'll see you next time on Health News You Can Use.